The horrors of the battlefield have driven some of the most significant advancements in medical technology and practices. Throughout history, war has been a catalyst for medical innovation, with each conflict spurring new techniques and technologies to save lives and improve the care of the wounded. This video explores the critical medical innovations that have emerged from wartime, highlighting their impact on both military and civilian healthcare. Ancient beginnings and battlefield medicine. The origins of battlefield medicine can be traced back to ancient civilizations, where rudimentary practices laid the foundation for future advancements. In ancient Egypt, Greece, and Rome, early surgeons developed techniques for treating wounds and fractures. The Greeks, for example, practiced wound cleaning and developed early forms of surgical tools, while Roman military medicine included the use of field hospitals and the establishment of a medical corps. During the Middle Ages, Islamic scholars and physicians made significant contributions to medical knowledge, including battlefield medicine. The works of Ibn Sina, Avicenna, and al-Zarawi, al-Bukhari included detailed descriptions of surgical techniques and the treatment of injuries, which were later translated and used in Europe. Napoleonic Wars and the birth of modern military medicine. The Napoleonic Wars in the early 19th century marked a turning point in military medicine. Dominique Jean Larrey, the chief surgeon of Napoleon's army, revolutionized battlefield medical care by introducing the concept of triage. Triage prioritized the treatment of soldiers based on the severity of their injuries, ensuring that those in greatest need received immediate attention. Larrey also developed the flying ambulance, a horse-drawn wagon designed to quickly transport wounded soldiers from the battlefield to field hospitals. These innovations significantly improved survival rates and set the stage for modern emergency medical practices. The American Civil War and advances in surgical techniques. The American Civil War, 1861 to 1865, was a brutal conflict that resulted in a staggering number of casualties. The sheer scale of the war prompted numerous advancements in medical care, particularly in the areas of surgery and sanitation. Surgeons like Jonathan Letterman, known as the father of battlefield medicine, developed more organized and efficient systems for treating the wounded. Letterman's innovations included the establishment of field hospitals, the use of dedicated ambulance corps, and improved medical supply chains. The Civil War also saw the widespread use of anesthesia in surgery, allowing for more complex and humane procedures. Amputations, a common procedure for severe limb injuries, were performed more efficiently with the aid of ether and chloroform, reducing pain and improving outcomes for soldiers. World War I. The dawn of modern trauma care. World War I, 1914 to 1918, introduced new horrors to the battlefield, including trench warfare and chemical weapons. The need to address complex and severe injuries led to significant medical advancements. One of the most notable innovations was the development of antiseptic techniques and the use of new antiseptic solutions, such as Dakin solution, to prevent infection. The importance of wound cleaning and sterilization was emphasized, leading to a decrease in infection-related mortality. Blood transfusions also became more practical during World War I. Advances in the understanding of blood types and the development of anticoagulants, such as sodium citrate, allowed for the storage and transfusion of blood, saving countless lives. The establishment of blood banks near the front lines was a critical step in modern trauma care. World War II. Antibiotics and surgical advances. World War II, 1939 to 1945, saw further advancements in medical care, driven by the need to treat large numbers of casualties. One of the most significant breakthroughs was the widespread use of antibiotics, particularly penicillin. Discovered by Alexander Fleming in 1928, penicillin was mass-produced during the war and used to treat bacterial infections, drastically reducing mortality rates from infected wounds. Surgical techniques also advanced during World War II. The use of plastic surgery to treat burn victims and reconstruct facial injuries was pioneered by surgeons like Archibald McIndoe, who treated Royal Air Force pilots. The war also saw the development of new techniques for managing chest and abdominal injuries, which had previously been difficult to treat effectively. The Korean and Vietnam Wars. MSED units and helicopter evacuations. The Korean War, 1950 to 1953, and the Vietnam War, 1955 to 1975, introduced new medical innovations, particularly in the areas of rapid evacuation and mobile surgical units. The concept of mobile army surgical hospitals, MASH, was developed during the Korean War. These units could be quickly set up near the front lines, providing immediate surgical care to the wounded. The effectiveness of MASH units in saving lives was demonstrated throughout the conflict and became a staple of military medicine. Helicopter evacuations, first used extensively during the Korean War, were further refined in Vietnam. The use of helicopters, or medevacs, allowed for the rapid transport of wounded soldiers from the battlefield to medical facilities. This significantly reduced the time between injury and treatment, improving survival rates and outcomes for those with serious injuries. Recent conflicts and technological innovations. Recent conflicts in Iraq and Afghanistan have continued to drive medical innovation. Advances in body armor and vehicle design have improved protection for soldiers, but they have also led to an increase in complex injuries, such as traumatic brain injuries, TBI, and blast injuries. To address these challenges, new medical technologies and practices have been developed. One such innovation is the use of advanced imaging techniques, such as portable ultrasound and CT scanners, to quickly diagnose and assess injuries in the field. The development of hemostatic agents and advanced bandages has improved the management of severe bleeding, a leading cause of death on the battlefield. Telemedicine has also become an important tool in modern military medicine. Advances in communication technology allow medical personnel in the field to consult with specialists remotely, providing better care for complex injuries and conditions. This technology also enables the monitoring and support of soldiers' health in remote or austere environments. Psychological care and rehabilitation. As the understanding of psychological trauma has evolved, so too has the approach to mental health care for soldiers. The recognition of conditions such as post-traumatic stress disorder, PTSD, has led to the development of more comprehensive mental health services for military personnel. Early intervention, counseling, and support programs are now integral parts of military medical care, aiming to address the psychological impact of combat and improve overall well-being. Rehabilitation and prosthetics have also seen significant advancements. Modern prosthetics, often incorporating advanced materials and technology, provide better mobility and functionality for amputees. Rehabilitation programs are designed to support the physical and psychological recovery of injured soldiers, helping them reintegrate into civilian life. The history of medical innovations in war is a testament to human ingenuity and resilience in the face of adversity. From ancient battlefield practices to modern technological advancements, each conflict has driven progress in medical care, saving countless lives and improving the quality of care for both military personnel and civilians. As warfare continues to evolve, so too will the medical innovations designed to mitigate its impact, ensuring that those who serve receive the best possible care. The legacy of these innovations extends far beyond the battlefield, benefiting society as a whole and highlighting the enduring importance of medical advancement in the context of conflict. What do you think of our video? Please let us know in the comments below. Don't forget to like, share, and subscribe. Thanks for watching.